We're experts at managing things in Nigeria, aren't we? Especially when it comes to our own health. Today, we're going to talk about those quiet signals our bodies send us. The ones we usually just brush off, and how a simple change in how we think can literally be a lifesaver. This line really just says it all, doesn't it? The most serious health issues, they don't always show up making a lot of noise. No, they usually start with a whisper, something that's just so easy to ignore.
I mean, we've all been there, right? That pounding headache you just know is from being stuck in Lagos traffic. That little burn in your chest you're absolutely sure is from the peppery suya you had last night. Or that bone-deep tiredness you just chalk up to the daily hustle. These excuses, they feel so real.
So the big question is, why do we do this? Why is our first instinct so often to just wait and see, instead of getting things checked out? Well, it's not just about being tough. It's actually really deeply rooted in our culture and our day-to-day lives.
And look, the reasons are complicated. First off, there's the very real cost. We all know a trip to the doctor isn't cheap. Then you've got families saying, don't worry, it's nothing, and you want to believe them. And of course, there's our own judgment. If it doesn't feel super dramatic, we just assume it can't be that serious. This is what that let's manage it culture is all about.
So instead of the clinic, what do? We pop down to the chemist for some painkillers, or maybe we try that herbal mix our auntie recommended. And all the while, we're telling ourselves that one comforting phrase: it will pass. It's a totally understandable reaction, but it's also how we can end up masking a much bigger problem.
Okay, so let's try something. Let's try to flip the script for a minute. What would happen if we stopped thinking like we normally do and started trying to think more like a doctor when we notice these little signs?
This is the big question, isn't it? What if that headache or that tiredness wasn't just a one-off thing, but was actually part of a bigger story your body is trying to tell you?
And this chart, wow, it just lays it out so clearly. While we're saying, it'll pass, a doctor is thinking, is there a pattern here? While we're blaming everything on stress, a doctor is asking, does it keep happening? Is it getting worse? They operate on the principle that whispers, well, they come before the screams. It's not about drama for them. It's about the data.
So what this all boils down to is a simple idea: pattern recognition. And listen, this is not about panicking over every little ache and pain. Not at all. It's about becoming a good observer of your own body, noticing what sticks around, what feels different than it did last month, or what other little symptom has shown up alongside it.
All right, now that we've got that idea of pattern recognition in our heads, let's get really practical. Here are a few common, seemingly mild symptoms that doctors always pay close attention to. So let's start with chest discomfort. We are so quick to blame peppery food for everything, but a doctor's going to ask, does it feel more like a pressure or a heaviness? And here's the kicker. Does it happen when you're just sitting down doing nothing? That context changes everything. What about swollen legs? Oh, it's so easy to just say, I was standing all day. But a doctor is looking for persistence. Is it happening every day? Is it happening in both legs? That could be a signal from your heart, your kidneys, or even your liver.
The cough. The go-to excuse is always harmattan season, right? Or just general dust. But the key medical question is about how long it's been going on. A cough from dust should go away, but one that hangs around for weeks on end without getting any better, that is a pattern, and it needs a closer look. And now this one is tricky, because at first you might think it's a good thing, losing weight without even trying. But from a medical standpoint, that's actually a major red flag. When your body starts dropping weight for no clear reason, it's a huge sign that something big is changing internally.
Okay, I know we've gone through a few signs, but the goal here is not to create anxiety. It's the opposite. It's to empower you with some calm, really practical steps that you can take.
So here's a simple game plan. First, just track it. A little note in your phone is perfect. Second, try to avoid just taking painkillers over and over if it keeps coming back. You might be silencing a really important message. Third, think about the context. What else is going on with you? And finally, just talk to a health professional. An early, calm conversation is so much better than a late, panicked emergency room visit.
And that's really what this is all about. This isn't about becoming a person who worries about every little thing. It's simply about making a shift from dismissing things to paying attention, from just managing it to actually understanding it. Because paying that calm, consistent attention, that is one of the most powerful things you can ever do for your health.